you just hear suicide is haram. And so people don't want to cross that line. So they don't want to discuss it. And so when it happens, a lot of times people cover it up in their families and their communities. So I think we really need to get to a place where suicide is spoken about, because it is an unfortunate reality that does take place.
Salam, thank you so much for taking the time out to speak to us on such an important topic like this. It's suicide prevention and raising kind of awareness about mental health issues, I feel like isn't really talked about enough in our community. And I know even TMV, we should be doing a lot better here as well in terms of talking about this issue. So I'm really, really thankful that you guys took the time out to speak to us on this. But I guess kind of my first question is, what is Muslim Youth Helpline? And what are both of your roles, I guess, within the organization?
So Muslim Youth Helpline, we are a listening service helpline that provides emotional support. We've been doing this for 20 years. We've just celebrated our 20th anniversary. And it essentially is a safe space for young people and young Muslims in particular to engage with us, for them to discuss anything that's on their mind and for us to support them through that discussion. Like I said, it's a safe space for them to lead that conversation. We currently have 4 platforms that young people can use to engage.
Primary concerns surrounding family issues, religious advice and spirituality, relationships, and surprisingly, depression and anxiety began creeping up into our primary concerns list as well. In 2021, most of those are still there. Anxiety and depression are much higher in our primary concerns list. But we also tend to have, I think, more serious mental health concerns coming up on our helpline as well. So we're seeing suicide, suicidal thoughts, we're seeing abuse, and we're seeing other mental health concerns come up as well.
Is it safe to say then that lockdown has created this huge increase then in the number of calls you've received and the severity of it maybe?
I think it would be safe to say that, yeah, because we did see a very large increase after lockdown. And then our calls also tended to become more serious. So on our helpline, for example, our officers all became mental health first aid qualified, because we saw that a lot of our calls tended to be mental health concerns. And they weren't fully equipped to handle that because that's not what they were facing beforehand.
Our monthly inquiries discussing suicide more than doubled after April of 2020. We've actually surpassed that number already in 2021. With us receiving more than around 4 to 5 calls a week involving suicide and suicidal thoughts. So something that increased after lockdown has continued and plateaued onto the helpline.
What are some of the reasons, I guess, why people do struggle with suicidal thoughts?
So I think one of them is that it's definitely not spoken enough about. So I think right now we're at an interesting change in the mental health world where we are speaking more about mental health and we're speaking more about anxiety and depression. But I think suicide is still a bit of a taboo subject. We're scared to ask our friends, are you having suicidal thoughts? Have you had suicidal thoughts? We're scared to ask our families, our loved ones. So I think it's something that kind of goes under the radar, just for fear of speaking out at times.
Because it's not something that may not have materialized into something so severe. For example, having anxiety or mild anxiety or mild depression, if it's not diagnosed properly and it goes undiagnosed and not treated, then eventually it can become something that's quite severe. And so it falls back into are we not discussing it enough? And are we not seeking support when we need to for ourselves or for our loved ones? Are we not supporting them? Are we not supporting ourselves through it? And something that can be diagnosed and treated and not eventually have to be something so severe goes undiagnosed or even misdiagnosed sometimes because of the communities that we're from.
And I think another issue with just not talking about it enough is that we don't, in turn, we're not able to recognize what it is. So I guess my next question is kind of how do we know if we're even having suicidal thoughts, or if someone we know and love are having, suicidal thoughts? Is it in line with depression and anxiety, or is it something separate? Or I guess what are some of the common signs that we can all look out for?
I think suicidal thoughts and behaviors especially are quite severe in the spectrum, because you're no longer thinking about I can't deal with my day today. You're thinking I actively want to end it. And by doing, I'd like to end my life by doing so. And that's quite a severe thought, and that's quite a severe decision to come to. So you have to realize that oftentimes people feel like they're at the end of their rope, but they may not show that in their day-to-day lives. So it exists on a continuum almost, where at the beginning you might just think about it and then at one point you might plan for it. And at one point you might acquire the materials you require for it until eventually completing it.
Suicide prevention is actually really effective. So if you know the warning signs, you could be that individual that supports someone that is in need. And sometimes all they need to know is that someone cares. There was a recent study done in a hospital, and I think it was a US study, actually, and it didn't have to be a loved one that they thought would miss them or would care, but it was just the idea that the hospital gave them a letter to say, this is the support that you might require, and these are the numbers. So it wasn't anyone that they actually knew, but it was actually from the hospital administrator. But that was someone that they could hold on to, that could potentially check in on them. So the feeling that someone cares is very important. So knowing the signs and proactively understanding them and acting on them is vital and could save a life.
I mean, I think we can all agree on how vital it is to have, a helpline like this and so many others, but there's still that kind of taboo and stigma that we've mentioned before, but and especially I think within the Muslim community is something that I've noticed. But I guess why, in your opinion, why is there such a taboo and stigma against just even discussions around suicide prevention?
This is a very important question, and one that Hadil and I are constantly asked because of the work that we do. And we go back to some of the main foundational reasons, and one of them being, and it's easy to say, that at the community level there is taboo and stigma. Now, as a community, we've only just started to accept the idea that people may need mental health support. Now, suicide is one element of that, but we're still very far behind in discussing that. So it's really important, not just as a community, but as a society, that we're looking at suicide along community lines.
But I think especially with suicide, you just hear suicide is haram, and so people don't want to cross that line. So they don't want to discuss it, and so when it happens, a lot of times people cover it up in their families and their communities. So I think we really need to get to a place where suicide is spoken about, because it is an unfortunate reality that does take place.
But what are some tangible ways that we can help normalize getting help, so that more people feel comfortable and able to even reach out to a helpline like yours?
I think maybe a first step is, I think community leaders really should have more of a responsibility in sharing information, and especially misinformation when it comes to mental health. So whether that's your local imam or like your cultural leader, a lot of times I think the mismatch in information comes between generations. And of course I can't generalize, but at some point you realize that maybe some of the older generations don't have as much awareness when it comes to mental health concerns. And so that's why people automatically turn to, it's a lack of spiritual faith, and that's why you're facing this, or it's jinn and that's why you're facing this. So I think when it comes to our community leaders, if they're able to speak up about it and raise awareness, I think that would do a lot of good in the Muslim community.
I'd say having more safe spaces where people can talk about things, like MYH or other helplines, and then those places have to be a safe space that resonates with that young person, where they can trust, that they can use terminology that they're comfortable with. That's really, really important. And building that trust, eventually they will open up, and it could be that lifeline that actually helps them. And so having organizations or spaces that really resonate with young people and gain their trust, but also are widely available to them, through any means possible, find out what is the best communication channel for young people and create those spaces. That's, I feel, is very, very important.
Often we see, like, on our helpline, people come and they say, I've tried going to the NHS or speaking with my GP, and they just don't understand. They don't understand, the details that come with somebody's culture, and being between two cultures in the UK and wherever else they may be from. So I think definitely if mainstream services could understand and maybe engage more with different communities, that would really help as well.
Thank you so much again, really, honestly, for taking time out twice now to speak with us on such an important topic. And I genuinely hope that more people, myself included, can learn to ask for help when we need it, contact people who we may not normally keep in contact with, just to check up on people. But yeah, I've learned so much.